Hey y'all, welcome to another week of the Mama and Minnie Show with Shola and Iman. So, April 23rd through 29th is National Infertility Awareness Week. Because of that, I wanted to make a video of some things I learned about infertility this past week. So, to be honest, I'm no expert at infertility, but once I found out this week was National Infertility Week, I realized that I needed to do some research so I could at least have a general knowledge about infertility. In this video, I'll just be sharing some general knowledge about infertility and how you can be an ally to mothers who are dealing with infertility. Infertility is the inability to have a child even after a year of unprotected sex. For women over the age of 35, you can be classified as having infertility issues after 6 months of being unable to have a child. The inability to have a child affects 6.7 million women in the U.S. That's about 11% of the reproductive age group. Quick, true or false, infertility only affects women. If you said false, you're completely right. Men can also deal with infertility issues. There's a lot of stigma around men dealing with infertility issues and it isn't talked about as much. When a couple struggles to get pregnant, either the man or the woman could be the one dealing with infertility issues, or they both may be dealing with infertility issues. About 12 to 13 out of every 100 couples in the U.S. struggle to become pregnant or carry the full pregnancy to term. There is no one cause of infertility. Multiple factors can play a role. There can be a number of reasons. Two people may be infertile and have two very different reasons of why they're infertile. Different factors like smoking habits, alcohol intake, age, body weight, low sperm count, dropped fallopian tubes. Multiple things could be the reason for why people struggle to get pregnant and to keep the pregnancy. Infertility can be classified into two groups: primary and secondary infertility. Primary fertility is when a woman or couple has not had any children and struggles to get pregnant for the first time. Secondary infertility is when a woman or couple has had a child or children before and struggles to get pregnant again. Dealing with infertility can be a long, emotionally taxing process, not to mention a physically taxing process. There is hope because there are treatments and procedures available to try and fight against infertility. Because there's so many different reasons for infertility, there's a bunch of different treatments as well. Two of the most common procedures are IUI and IVF. IUI is intrauterine insemination. It's when healthy sperm is collected and deposited directly into the uterus so that it's easier for the sperm to fertilize an egg. IVF is in vitro fertilization. You've probably heard of IVF. It's one that's popular in the sense that it's talked about a lot. It's mentioned in TV shows and popular culture, and many couples use it. However, it's not as common as people think. IVF are when sperm and eggs are fertilized outside of a woman's body, and then the fertilized egg is placed inside the woman for her to carry the pregnancy to term. IVF is extremely expensive and it's an invasive procedure, so it's not a viable option for many couples, but it does help many other couples have children. Other treatment and procedures are things like donor sperm, donor eggs, surrogacy, and even adoption. Infertility can even be treated with prescription medicine depending on the cause of it. Unfortunately, a lot of times there's no quick fix to infertility. It's a long and difficult road of multiple procedures and treatments and options, and a lot of hoping and disappointment for many families. However, dealing with infertility does not mean that a couple is not meant to be parents or that they won't be parents. It just means that they have to take a longer road to get there. People dealing with infertility can seek out the help of fertility specialists, whose job it is to diagnose the causes of infertility and come up with a treatment plan for it. If you know someone dealing with infertility, there are several ways that you can be, if not helpful, then at least not harmful. Helping someone who is struggling with infertility, never, ever, ever minimize the problem. Don't ever minimize the problem and say things like, well, at least you get more sleep, or at least you don't have to worry about someone else 24/7, or at least your house stays clean. Don't say, oh, don't worry, it'll be over soon, or dismiss them. Even though you're probably trying to keep their spirits up, a lot of times this can have an adverse effect, and people can think that you don't really take their struggle seriously. Don't assume anything. Don't come into the conversation thinking that you know every solution. If you're not a doctor, don't diagnose them. Couples who have struggled with infertility have likely struggled with it for a long time and have consulted a number of specialists and have thought about a number of treatments and options. Don't ask couples why they haven't just considered adoption or why they haven't just considered surrogacy. One, that's very invasive, and two, they probably have considered it and have their own reasons for not taking that path or not taking that path yet. When talking to a couple dealing with infertility, if you have the urge to ask them whose fault it is, don't pry and don't use terminology like fault when talking about infertility. Practice mindfulness when helping couples struggling with infertility. One thing I always try to practice is to listen more than I speak. And if you do that, you'll come to the most important thing when dealing with people who are struggling with infertility. Take cues from them. This could be a very awkward and emotional conversation for them to have or thing for them to bring up, and they're leaning on you for a reason. Take your cues from them about what they need in that moment. Maybe they do need solutions offered up. Maybe they just need someone to listen to them. Read their body language, read their verbal cues, and give them what they need. This is about them and being there for them. So that's the basic knowledge I learned about infertility over the past few days. I will continue researching this because I feel like it's a topic that more people should know about, and it should be spoken about a lot more because it could help the people struggling with it if more people were knowledgeable on the subject. I will be including links below to resources for people who are struggling with infertility and resources for people who are helping those struggling with infertility. If you haven't already, make sure you like this video. Make sure you hit the subscribe button so you never miss a video from Iman and I. And we will see you next week.